consultation. So yes, Mohsen.
Hello everyone.
Hi.
Hello.
Yes, so it was a great consultation. You managed to do almost everything. Maybe ICE could have been explored. What are your
I did the ID and concern.
yeah, but what are sort of your expectations from today's consultation, since it's a very acute condition? Other than that, in the management, also hobbies, what kind of activities does he do? Does he participate in exercise? Does he do any strenuous activities? Those. And in management, vascular surgeon involving and the referral criteria. So these two things could have been. But other than that, the way you dealt in the rapport building and the way you educated the patient, that was extremely important.
Thank you.
Well done. Well done. That's a nice feedback. So I want to hear from Ramesh first, like what she think about Saira. Then I'll come to myself. So
Dr.
yes.
Ramesh, go ahead.
I think I took the history okay. I did all the important points in the history, and the IPS I was okay. I asked about the concerns again and again, about the pain as well. Yes, I could have done better in the management part if I could have had time. I think I took a minute long in the history part.
Mhm.
Other than that, it was
Did you-
okay.
Did you request for the ultrasound jelly scan of the tummy? Well, that was that is the diagnostic thing, the first diagnostic thing.
Definitely. So
And after that, you go on to the CT scan.
Yes,
So that is what establishes whether you need to admit the patient, let them go, or it's an emergency.
have you mentioned CT scan as well?
That would come after that, yeah.
I am going to send you to the hospital, and I'm going to
Yes. Yeah. Definitely, Ramesh, consultation was good. If as the A&E doctor, if someone asked me, do the diagnosis and treatment plan in 1 minute, I would say, okay, pain, abdomen, radiating back, palpable mass. First, I will do ultrasound scan. Will measure how much it is. Order scan, order CTPA, will call surgeon. That's it. This is a simple management as A&E doctor. So these things shouldn't be missed. So what would be the presenting complaint, like Sarah said? Sarah, first you finish with your all of the briefing.
Yeah, I think she did very well. I was very well looked after. The way she consoled me. When we teach consultation structures, we do everything, but consolation is usually missing. This is what I come to know in my private clients a lot. That we reflect, we do everything, but we forget to console. She did. She said she's going to look after me and sort me out and everything.
Yeah, that was perfect.
I felt very secure that I've come to the right place and she's going to sort me out, number one. And then, yes, a little longish data gathering, we all fall prey to that. That's the normal trap we fall into, all of us, even after so many years of experience. Well, that was done. And yeah, after that, all the tests were requested. If you would say jelly scan or ultrasound and a CT scan, that would, like Dr. Zeeshan said, that would sum it up. And then according to the findings, you would be managed. And my senior colleague, which is going to be a vascular surgeon in this case, is going to manage. I'll have him consultation request, and he will give a second opinion. And that's what you go. They want to hear whether you recognize the urgency to admit and investigate, whether you're letting him go or you just want to know. You will admit him on a monitored bed. You have to keep a strict eye on his blood pressure, because if it's a dissection or a rupture, he's going to just collapse in no time. So you are going to admit him on a monitored bed, put an IV line, keep an eye on him, do a jelly scan followed by a CT scan, and an urgent consult by my senior, who's going to be a vascular surgeon.
I want to add on a few things. First of all, I would like to share my screen. Two things I'm going to share. One, I'm going to share the sketch for this aortic aneurysm, because this one is very famous nowadays. Examiner love to give those scenarios where the students are struggling. where the doctors are struggling. So in terms of Ramesh consultation skills or anyone, when you're going to assess, so when we are going to assess anyone, so you should have a structure. So that is an ebook from our UKPass Academy consultation structured ebook. So I will show you how the Ramesh has done well. So you will understand why Saira was saying that she done very well. So we have this ebook ready. So anyone need it, you can just speak to us and we can show you how you will get that. You just need to send us message. So these three parts I was assessing Ramesh. So if I would examine her, I'll be assessing her on the data gathering part, management part, and interpersonal skills. So data gathering part, she scored very well. So I will tell you how she scored very well. Interpersonal skills, she scored very well. But again, I'll come to a few points, but how I was assessing her. So I was assessing her that she is taking history of presenting complaint or not. She done well. She ruled out all the things which was specific in this history. So she did ask about that history, general background. She did ask, she did the psychosocial idea, expectation, concerns, and data gathering part was where the management was starting actually. So you need to remember the management would start when you tell the findings. So the only thing which was, I don't know, I heard from Ramesh or not, have you explained the findings? The management start explaining finding. If you feel a mass, when you see your PLAB results, in the PLAB results, what you would get, it would be written the finding cross or not. If you don't explain finding to the patient, is the finding is not for diagnosis. Do you explain that finding to the patient? So this is examination finding. You need to explain that, Michael, after assessing you, I could feel some lump or something like on your tummy. And that's why after that, you explain diagnosis. She explained the diagnosis very well. And she was patient-centered and the treatment plan was patient-centered. But how to score good in 2 minutes of management part, because you have to make a whole of the list checklist. I'll be coming to that. Interpersonal skills was very good. She was very polite. Like if I say as examiner, I was looking at a very professional doctor. She is not panicked. She's calm and composed. She's not worried. So she was trying to manage patients. So this is what we